Thank you so much, Caitlin. My name is Dr. Kim Yu, and I just thank the Ohio Academy of Family Physicians for inviting me to this Wellness Wednesday webinar. I'm really excited today to talk to you about building your connections with your community, not only just for your community, but for yourself as well. And we're going to talk a little bit about that over the next 45 minutes. Let me start by sharing my screen. So I'm going to try and find my PowerPoint in here. And there you go. Okay. So we talked a little bit. Caitlin introduced our objectives, so I'm going to skip this slide and dive straight into this. So why should we connect with our communities? Well, we know that if we want to reach the quadruple aim of better outcomes at lower cost, improve patient experience, and improve clinician experience, we need to be able to connect with our communities, to be able to create the ideas and collaborate with our patients to empower them. And I think back to this picture is actually a picture of my daughter. And I was about her age in this picture when I decided I wanted to be a physician. And maybe it's, you know, when you think about what was it that made you want to go to medical school in the first place, you probably weren't thinking quadruple aim, right? That wasn't it. You know, it was you wanted to help your communities, you wanted to help your patients, and this is how we do it, we connect. So how do we do that? Well, during your each and every patient encounter, you're already building those connections with your patient. But maybe you're already building those connections with the patient's family as well, or the people that come with the patient. Outside of the patient encounter, you will do this individually. And I think, you know, this is an example, just something silly that happened this past week. I went to a Minecraft convention with my son. And I thought, you know, this is just all for him. I'm just going to go. I'm just a chauffeur. But lo and behold, I go there and I meet a PhD, a researcher from a local university who's doing research on Alzheimer's and the use of Minecraft. And before I know it, he's wanting to engage and try and get people from the physician community involved in his work. And I thought, wow, this is amazing. This is a great connection where I can connect people in our community with this university. And that just happened. This could happen when you go to a local coffee shop or a restaurant or wherever you're at. You can meet people that can really help you connect with your community. It may be local organizations, your church family, or different scouting organizations, Girl Scouts, whatever it may be. It's really exciting to be able to build those connections. And what about other local medical professionals? You know, many of you may be involved in your medical society or in the OAFP, in the AAFP. Do you get together with them even just outside of those meetings? It's great to be able to do that in real life versus also online. So now we can share this webinar online. We can actually do a lot of things over social media that we couldn't do before. And being able to connect with your community via social media is a really great way of engaging with your community. And I'll talk a little bit about how do you build connections with your community, both at your workplace and outside your workplace. This diagram really speaks to the American Institute for Research, where they have a 3-level framework of how do you engage patients and really what does patient engagement really mean. So you can have patients that you engage with from obviously patient direct care, but what happens if you have a patient that really has interest in organizational design and wants to be involved, maybe even in your practice, they could be a patient advocate. Or maybe, can you imagine if we were able to have patients in our practices help us with policy making and calling legislators about bills, whether it be on teaching centers or graduate medical education funding or scope of practice. I know that when I had my own private practice for over 10 years in Michigan, there were multiple times where I had asked my patients, I would print out a letter saying, these are the issues that are at stake. Please contact your legislator. I listed the ones that were local to my practice and asked my patients. And to be able to have that type of engagement from your patient really helps them see that you're involved and invested in their community. not just in their health. The AAFP has also asked family physicians about social determinants of health. Now, before you all glaze over, because sometimes, I mention this and people start glazing over. And, it really is important when you look at your health of your community and also your patient's health, if we totally understand all the different factors that are involved in their health. And some may ask, what is the definition of social determinants of health? It's the contextual environmental factors that really give rise to health inequity for your patients. So whether it be poverty or educational equality, food insecurity, access to transportation, housing, unemployment, violence, public safety, all of these things, basic utilities, our understanding of our patients' social determinants really can help us address their barriers and their needs. And when the AAFP asked family physicians what were their opinions about this, 83% of family physicians agreed that we should try and help identify this. But 80% of us said, we don't have time to discuss this. We have barely even 10 to 15 minutes to talk to our patients about the things that we need to talk to them about. Well, there are resources available through the AAFP website. I really, really highly encourage, if you've never been to it, go to the Everyone part of the AAFP.org website and look at the Everyone Project, because there really are great tools there that will really help you be able to address these. So how do we find out about social determinants of health? Well, we need to be able to screen for these. And so here I've listed 3 different screening tools. I do recommend number 2 because it's really easy. It's a short form with 11 questions, and you can have the patient self-administer this. They can read it and fill it out themselves, or you can have an MA or a scribe help you with this as well. But it's really important to try and get the information so that we can really address these social determinants. And when we find out what they have, well, it addresses the vulnerabilities and really the barriers, and really helps us look at ways in which we can refer to services and also decide on follow-up as well. So on the website, on the AAFP Everyone website, there is a toolkit. And so you can see not only the screening tools that are available, but also other resources that are available. And here's a really great resource, the Neighborhood Navigator. When I first saw this Neighborhood Navigator, I was blown away about what you could actually discover in your own community that I didn't even realize. All you need to do is put in your zip code, and it will tell you resources for food, housing, transportation, unemployment, legal aid, financial, dentists, whatever it may be in your community. It really helps you find out if there are resources. Now, you may go to this Neighborhood Navigator and say, I don't see something in here. Well, let the AAFP know, give your feedback and say, well, these are some other things that are in my neighborhood, and we can help grow and expand this Neighborhood Navigator. So for your practice, think about family engagement, not just patient engagement, and get to know your patients. I think that's one of the blessings of family medicine, is that we are able to have those long-term relationships with our patients. I'm going to tell a story which I think highlights this. I had a patient who was in his 80s, and he comes in with his walker. He had severe arthritis, but having got to know him over several years, he said to me, I knew that he enjoyed ballroom dancing and dancing in general. And I would always ask, so how's the dancing going, as a measure of his mobility. And one day he asked, would you come dancing with me, doctor? And I thought about it and thought, well, okay, I guess I could do that, even though I don't dance. I mean, me dancing is not a pretty sight, right? But it was an amazing experience, one of those highlights of my 10 years in private practice, where I think back of one memory that I have was dancing with this elderly gentleman who put his walker to one side and then grabbed my hands and showed me how to dance the polka. And as he's whipping me around the room doing the polka, I mean, he could move. I was shocked. He was going around the room saying, this is my doctor. This is my doctor. And I can't tell you what that did for me personally. I mean, it was just such an a touching moment where I'll remember that forever. I had brought my family and they saw it too, and it was just one of those memories you remember. But I got to know his family, his sons, and later on, you know, I closed my practice and went into urgent care. And years later, like a few years later, I actually heard from one of the sons. He actually contacted me and said, "Dr. Yu, I found my father's address book and I saw your name and number in his address book. And I wanted to tell you how much you meant to him." And he told me about the time that I went dancing and when I went to visit his father and went to a birthday party that he had when he hit 90 and things like that. And so engaging with your patients, learning about his community really helped my well-being. It wasn't just about knowing about him, but it also helped me as well, know that I made a difference in that patient's life. So what else can you do? You could hold an open house at your practice or have some support groups. We're going to talk a bit more about social media later. You could share helpful YouTube videos. And I know Dr. Mike Sevilla in the Ohio Academy does amazing YouTube videos that he shares. Connecting with local community groups is really important, and we'll talk more about that too. And you can partner with local businesses, which is good for your practice as well. I'm going to say this though, for your own well-being, set clear goals and really pick one thing to start with. This is something I could learn from too, but pick one thing to start with and grow from there. And you also need to think about your own internal mission and vision. I like to think of it in terms of this word, ikigai. Ikigai is a Japanese term. It means the reason for being. It's the reason why you get out of bed every morning. And when you think of these four intersecting circles, something you love, you know, the world needs it, you're paid for it, you're great at it, that red spot, that middle spot is your purpose. It's your reason for being. It's where you want to be. And you have to think about that in your practice and what you're doing, but also when you're connecting to communities in different ways. Where is it that would bring you closer to that red spot? And think about your timeline. Maybe in your life right now, you can't add anymore. There's no way. But maybe in a year, or maybe in 6 months, maybe set a goal. Maybe in a few months, maybe this is something I can look at. Maybe it's something that you're already doing right now, but it's taking too much time. So really evaluate your own internal mission and vision to ensure that everything is aligned with your ikigai. So I'm going to talk a little bit about some practical ways that we build meaningful links in action. And this is a picture of Hurricane Maria. It was 1.5 years ago in 2017, and in Puerto Rico. And here you can see, I hope you can see, and I should probably move this window a little bit here. I'm hoping you're not seeing this. But you can see pictures of the physicians that were involved. And the Puerto Rico Academy of Family Physicians have many family physicians that I've met over the years and considered dear friends. I've even visited Puerto Rico. So when I heard about Hurricane Maria, I was like messaging them and saying, you know, are you okay? Do you need anything? And they said, we need power. Our practices can't open. We have no power. Can you get us generators? And I'm thinking to myself, I know nothing about generators. How am I going to get generators? So I'm like going to local stores and Home Depot and trying to buy generators and figure out how do I get this generator to Puerto Rico, and you know, what can we do and how can we raise money? And it was an amazing collaboration that occurred over months as it happened, but in the space of, you know, a very short amount of time. What started with, you know, one generator that we got actually in Texas, that someone from, 2 physicians from the Texas Academy of Family Physicians helped me with a generator in Texas, to, you know, this Facebook post that I posted asking for help. And I got help immediately came streaming in from the Indiana Academy of Family Physicians, who said they'd help host if we did a GoFundMe of some sort, you know, that we could raise money to be able to get these generators. So one Facebook post is how it started, and within one weekend, we had already raised $50,000, and within a few weeks, we had more than $103,000 that was raised to get 66 generators for physicians there. We had the physicians in the Puerto Rico Academy of Family Physicians, and also the Doctores Barbacoas, and many different organizations that helped us, both in the mainland and also in Puerto Rico, really came together. The Baton Rouge Association Coalition also helped us as well, BRIAC, and the AMA gave us a donation as well. But you can see how we all collaborated together. We came together because there was a need to be able to meet the needs of the community. And how that really helped, I truly believe we saved thousands of lives. Doctors were able to open their practices. We were able to get 60 tons of medications and medical supplies, equipment to Puerto Rico. It was a crazy time. I mean, I not only learned about generators, but I also learned about how do you get a plane. You know, we got a plane donated by the Dallas Mavericks, and Jimmy Changa's restaurant in Texas gave us a plane, and, you know, sponsored a plane, and Delta and many different organizations helped us so that we were able to get donations and send them over to Puerto Rico. There was a Jeep brigade, even physicians that would go at midnight to the airport in Puerto Rico to pick up all the supplies. I mean, and it was difficult and dangerous at times, but they went. Why did they go? Because they knew that their communities needed that. They had that connection with their communities, and they had we had stories of family physicians who, there was a family doc who got called by a local children's home, and they said, you know, we need water, we need food, and we were able to help bring that to them. So what was the consequences of building those meaningful connections? It really, truly was priceless to be able to know that we were able to help bring patients care throughout Puerto Rico. It really was priceless. What else can you do, and what else is happening? Well, in our community recently, in the past months, we've had 2 teenagers die by suicide. And this is a local thing, but I saw on CNN, there was a report even just this past week or two, actually this is from April 8th, where there was a report that went out, the number of children going to the ER with suicidal thoughts attempts has doubled. And so I thought, well, what can we do about this? There's a need here. We need to do something. And so what we are trying to do, I'm working with other physicians, both locally in Orange County and California, but throughout the country, is to build a suicide prevention network of family physician, internists, pediatricians, psychiatrists, psychologists, counselors, teachers, principals. We want to get legislators involved. I have 3 that really want to get involved locally. We want to get law enforcement involved, because these are our children. They're dying. And I was shocked, actually, moving from Michigan to California, the number of children that I'm hearing about dying by suicide has just increased exponentially, it seems. And we need to do something. So we're reaching out to community organizations, and there are obviously national organizations that are involved as well. But being able to connect everyone, I think that's what we as family physicians are able to do really well. And so if we're able to gather and have these brainstorming sessions of what are we going to do in this local community, how are we going to implement everyone having ACE scores on their kids when we do pediatric, complete physical exams? Can we make sure that we do ACEs and things like that? Making sure that we have the referrals in place and having protocols in place for if someone comes to your practice with, suicidal thoughts, what are we supposed to do? Making sure that we have that is really important. And I really look forward to working with maybe some of you. If you're interested in this, please do contact me. Maybe you're sitting there thinking, well, that's not an issue for us. What else can we do? Well, I'm going to give you an example of a clinic that when we were doing the Family Medicine for America's Health road trip, and they came to Detroit. This was a practice, an FQHC, that we really wanted to highlight because they do an amazing job at engaging with their community and reaching their community. And they have a space in their center where they hold Zumba classes, and they also have a teaching kitchen where they teach patients how to cook healthy recipes, and healthy meals, especially to their diabetic patients. They also would prescribe fruit and vegetables and would have a truck that would come once a week with fruit and vegetables for their patients to pick up for free, which was amazing. And they would organize events like this, Walk a Mile in Her Shoes for violence towards women. They would have men walking in red high heels, doing a mile in the red high heels to raise money for things like violence towards women. And so, maybe there's something like this that you could implement in your practice. What about at your workplace? How do you foster community? I think that it's become increasingly more common in family medicine to be employed. I think it's close to 60% or even more now that are employed. And I'm really grateful to be part of Vituity. It's a physician partnership, and they really work at bringing the joy to the practice of medicine. We have a joint medicine committee, and we think about ways in which we can build community, whether it be going out for a meal, as you can see here with some of our innovation team and directors of quality and performance, and our VITANs, as we call them, our practice management team. These are different ways, think of different ways in which you can build community. You could teach, and here we have Dr. Sarah Sands, who obviously teaches and is involved with core content, but you could teach and volunteer precept at your local medical school or the residency program. You can see a little picture of me teaching at an AFP conference. You could write, you could journal, do high school mentoring, so many ways in which you can engage with your community. And engaging with your academy on a state chapter level or nationally or even internationally is a great way to engage for your own personal well-being. I can't tell you, when I look at these pictures, I think about the relationships that I have with each and every one of the physicians here, and it just makes me smile and makes me feel so grateful and glad to have been able to be involved. Advocacy. Here we have also some more leaders from the Ohio Academy of Family Physicians. Getting involved in your advocacy day is a great way with meeting with your local legislators. You could also decide you want to run for office. We have the family docs who are doing that right now. And Dr. Ravi Grivoy Shah is running for school board, and Jen Bacani McKinney is also on her school board in Kansas. You could also decide you want to go to the AFP Summit. These are great ways in which you can get involved. Other ways, well, hosting a Global 360 student. And, you can reach out to me if you want to do that through WONCA and through the AFP. You could join a member interest group. That's something that came about as a resolution that I submitted, 9 years ago, maybe 10 years ago. And now there are 16 member interest groups, which is really phenomenal, from global health to small practice to emergency medicine to so many school doctors, telemedicine, so many. So engage with other physicians through your member interest group. You could join an online Facebook group. I started the Physician Moms in Family Medicine group 3 years ago, and we have over 3,000 close to 3,000 family physicians from around the world in that group. There is a physicians dads group, so that dads in the group, you are not excluded. And for those that are wondering, well, I'm not a mom and I'm not a dad, that you don't need to be. You just need to be male or female, and you can join those groups. We just put those, I put the word moms in there so that I don't have a whole bunch of men trying to join my group. So it's kind of crazy, the world of social media as it is. You could host a brain trust on a topic that matters to you. And WONCA, here you see a picture of many of the WONCA Polaris physicians that came to an event, a conference in Tobago. It was so hard. Yes, life is hard, right? We go to Tobago for meetings. But no, it was an amazing meeting. WONCA is an amazing organization. If you are an AFP member, you're already a member of WONCA. So please do get involved. And social media. So here we see WONCA. May 19th is World Family Doctor Day, and we will be definitely celebrating that day. But here you can see many of us at the WONCA meeting in Seoul, Korea last year, and we're holding up our little hearts, and this is a little signal for hearts. It was a great experience, and like when you talk about filling your bucket of wellness, this is a way to do it. You know, being with family physicians who get it, who are doing amazing things. You'll hear stories of phenomenal family physicians who are doing like stunning things around the world to connect with their communities. This little picture on the right-hand side of the screen, you'll see half, or not even half, maybe a third of the doctors that were involved in a Harvard X program where we actually did a MOOC together looking at global health, improving global health and focusing on quality and safety. So engaging with the global community to be able to help improve global health and the community of global health, that's exciting. And that's something that we can do. Whoops, I need to go back. So social media. Social media is something near and dear to my heart. It's something that many in the Ohio Academy have really taken the lead on, and Dr. Sibylla is definitely the king of social media. And this is a photograph of the social media ambassadors from 5 years ago. We've been doing this for at least 5 years. And last year we had the privilege of meeting Z-Dog. This is backstage meeting Z-Dog. Why is it important to get involved in social media? Sometimes people will ask me, and it's not just about the numbers. You can see that we track and see how much influence we might have in terms of the number of people we engage with on social media, but we've been able to stop 2 family medicine programs, 2 family medicine residency programs from closing because of social media, from tweets that we've had and from reaching out through social media. And we're able to engage with not only patients and our communities, but with other fellow physicians. There's a group called SoMe Docs, Social Media Docs, and we have meetups. We get together and we talk about social media. We talk about how to engage with other physicians and with patients. And it's really great. And you can use hashtags like the FM Revolution to really hone in something that really helps us hone in on a topic. So maybe for you, it's, you know, something else that you really have a passion about. You could create a hashtag and share it with us so that we can augment and share your voice and amplify your voice to others. And really, if you think about it, if we're able to amplify our patient voices so that we can improve their health and reach our legislators and reach those in power who are able to make changes to help our patients, wouldn't that be a good thing? So I'm going to open it up right now. I think we have about 15 minutes left, and then I'll close it up. So I'll stop the video. I'll stop share.
Great, so I'm going to move everybody over to viewer mode. And then as you are able to ask questions, please do so.
It's awesome. Hi, everyone. Hi, Mike. Hello, Penny. Roxanne. Hey, Jennifer, Tiffany, Bonnie. Kara? You'll have to tell me how I say your name. Kendra. Hi, everyone. Eric. Any questions, thoughts? How do you engage with your community? I'd love to hear your thoughts about this.
Hi, this is Roxanne.
Hi, Roxanne.
Hi there. So I have a question about the Everyone Project. I'm on the population committee for the OAFP. So
Yes.
I know we're going to be starting to work with it more at the state level. And that's great. But here in my small town, I know about the neighborhood navigator, and there's really not a lot for us, but I think there are other things. So suggestions on different people to try to connect with in a community, make sure that I don't miss anybody as I try to put together like who are our resources, trying to form some sort of a coalition even to kind of get started with this.
You know, one of the best ways of building coalitions is really to think about what needs there are and what you want to focus in. I would really hope that if you're talking from an Ohio Academy perspective, looking at resources, or as a practice level, because that's slightly different. So if you're thinking about from a chapter level perspective, I would look at different member organizations that are in your area that are doing work that really goes along with your goals and missions. So sit down, really hone out, what are your goals and missions, and really find out who are the partners that are really doing the work on that area and that space. We had at the Michigan Academy of Family Physicians, it was kind of interesting because we had people reaching out to us that wanted to partner with us on doing different things. And I'll give an example, the Michigan Dairy Council. And we were like, well, not really going to help us. But they were an amazing resource. I was really surprised at not only connecting us with different resources out in the community, but they were a great resource. Same with the National Kidney Foundation. I had a particular interest in kidney disease because my mother had kidney disease, but they reached out to us and said, we need physicians on our board. Can you send someone? And we were able to get a lot of resources about kidney disease for our family docs. So there's ways in which you can reach out to the pediatricians in the area, the psychiatrists in the area, to be able to build those coalitions. From the other perspective, looking at organizations that really have a lot of sort of pull. So the equivalent chapter of the American Hospital Association, and I love to connect in terms of health equity and workforce diversity and pipeline. If you have any organizations that are working with that, do try and reach out to them. And there are, and I'm blanking on the word right now, but there are organizations that can help with that. So I'm not sure I answered your question very well, but
you gave me some ideas because I was thinking more about my local, trying to start building the local, because I'm starting a new residency program. And so I'm trying to actually just even make a simple list of who do you call when you need this. So I'm new to the area.
Right. So I always like your major, your major subspecialties. You want to have the list of those that you want to call. And then you're going to have all of the area hospitals. And then you're going to have all the different organizations. So if you look at your map, so you can Google, different organizations and also businesses in your area that are really, maybe you have a very large Myers or Walmart or some different, Ford, maybe there's a plant nearby. Looking at those from a geographic population health perspective.
Yeah. I like the business idea is really helpful because we have chemical plants here. So.
Right. It's really important that you build those relationships so that you can talk with them about, well, what are the health needs that you might have? And then talk to the local doctors that are in that vicinity and say, hey, there's this. Would you like to have a brain trust meeting and talk about this issue? That's one way of doing it. And I really like, community organizations, whether it be perhaps there's a cluster. So for example, in Detroit, I worked a lot with the Sickle Cell Foundation in Detroit, and they were wonderful to connect me with different organizations that were doing really, really cool work in that area. So think about your neighborhood and the different communities and the organizations that you can reach out to. Any other questions?
Thank you.
I'd love to hear some of your ways in which you connect with your community, because I know that you've done awesome stuff. Like every single one of you, I'm pretty sure, has done amazing stuff. So I don't know if Mike is able to talk right now or if he's seeing a patient, but Mike, you do amazing things with your community. He's not able to talk. Anyone else? Eric, would you like to talk? Or ask something? I can't hear you. I can see your ear. There's
Can you hear
a...
me now?
Oh, yes, I can hear you now.
Much better. When I lived in a small town in Appalachian, Ohio, I joined the Rotary Club, and that provided me with an introduction to the city, especially the business community, and also it allowed them to become familiar with me, and then by extension, our practice. We were the only one in town at the time. So in a small city, it's easy to become involved quickly.
Yes.
I was also in the Historical Association and involved in the Great Ohio Bicycle Adventure, and it was rewarding. Now in a big city, a little bit less, but there's still the neighborhood association and living close by as well. I think that's part of providing primary care, is being simply a neighbor and a citizen with some kind of involvement.
Yeah, and it really, I mean, it helps us really connect with our patients more, I feel, when we're able to do that. I know that there was a moose club in Detroit near my old practice, and they invited me to do a health fair, you know, and I never thought I would be in a moose club, you know, and doing a health fair there, taking blood pressures, but it was a great way to be able to engage with the community. And we've done churches, and I know the AMA has a Doctor for the Day program too, where you can go into schools. So, you know, contacting your local school and saying, hey, would you like me to come talk about healthcare careers? Bring your white coat and your stethoscope. So that's a great way too.
Dr. Yu, I'm not as familiar with the Navigator quite yet, but are these some of the resources that they may find on there as well? Some of the organizations or specific resources needed that they could find in that tool?
There are some resources available, like that you talk about in terms of organizations. It's very dependent on area, quite honestly, by zip code. The data is pulled from Aunt Bertha, so and other resources. So it's not the AFP that's sitting there trying to input everything. So I have had comments back saying, you know, that they're not able to reach to see as much as they'd like. So it would be great if we could have some feedback on that to the AFP and to Aunt Bertha.
Sure, but maybe a place to start, if nothing else, if you haven't checked out that resource.
Right, definitely.
Awesome. Are there any other questions or comments or stories? We have a few last minutes here.
Any other questions? If not, I'm going to share the last part of the conclusion here.
Okay.
And let's see if I can do this. So really, just in conclusion, and you can continue to ask questions if you want after this too. It really starts with building connections, really starts with you, but it takes collaboration. No one can do this as an island. You know, you're going to burn out faster than like forever, like just faster than that. You'll be gone like a candle in the wind kind of thing. So really try and do this with others. It really does help. Really take time to assess your mission, your ikigai, and your timeline as to why and how and when you're going to engage with your community. decide on one thing to start with. You can always add if your time allows. Use the resources available to you, and please do look at the Everyone Project website and the Neighborhood Navigator. And, you know, I love this quote by Helen Keller, which said, alone we can do so little, but together we can do so much. We really are able to do so much more together. And I'm just thankful to the Ohio Academy of Family Physicians, to the American Academy of Family Physicians, to all the state medical societies and the AMA and all the different physician organizations that are out there that are really looking at physician well-being, at quadruple aim, at all of the ways in which we connect with our communities, because together we can achieve so much more than alone. So thank you so much. And here's some references. And we're going to be posting these references on the links. And also here's my contact information as well.